just to share with you a little bit, my plan today is just to share with you a little bit about my story and, maybe in hindsight, some of the lessons that I learned along the way. But what a great time to be an entrepreneur. I mean, I can't imagine a better time in this country than to be an entrepreneur right now. There's financial support, there's lots of people willing to fund, there's mentorship, there's support from families. Middle class families are saying, forget being a CA, forget being a doctor, forget being a lawyer, go be an entrepreneur. I mean, this has never been the case in India before. So it's really fantastic to see. And when the PM stands up and makes a clarion call saying, start up India, stand up India, you really know there's some craziness going on in this country as of now. So my story really started in 2001. And yes, I was very young. I was only 21. I came back from the US. And I found a void in the market where I felt like health services, like Shrikant mentioning about educational services, was actually a very local business, and by the way, continues to be. Even today, 90% of specifically pathology labs are fragmented, and they're all individual. Down the street of any place that each of you live, in any city in India, you'll find a range of 10 pathology labs in your lane. And this is how it was in 2001. The difference was that at that time there were zero standards, right? So literally, you can walk into a lab, which is about 200 square feet. There'll be somebody who will pull your blood. There'll be dirty cotton on the floor with blood stains. There's always a smell in the air. Gloves were not used. Disposable vacutainers and needles were not used. I mean, if you think about it, it was crazy. But the opportunity that I saw then was to say that, look, is there really a chance to build a branded, standardized chain of centers across the country when the market is so fragmented and where each lab is like a local Amitabh Bachchan, where each doctor is the master of his own area, where each doctor has maybe the residential communities of the few buildings around them, around the doctor's lab, coming to that lab. And it was such a local community-based thing. And, the pathologist in one small part of Bangalore was not known in the other part of Bangalore, etc. So this was the vision, but frankly, there was really no clear way of how do you really build the standardized chain. So the questions were really, how do you go about making something that is so local into something where people start respecting having a chain or having something standardized? And there were a bunch of problems there along the way. The second question was, where do we get funding from? Because at that time, again, there was not that much funding available. The third, by the way, was youth was not an advantage. The fact that I was in my 20s was a severe negative for me. The fact that I was a woman was a significant negative for me, because I remember talking to investors and a bunch of them saying to me, but you will get married now, then after that you will quit, so what will happen to our money? Or you must be really young, are you going to go for an MBA, what will happen to our money? So there were a lot of these questions where being in your 20s was not necessarily a good thing. So what I felt was that there are lots of these pathologists who are across the country who are doing well in their own domain, right? In their one little location, they're doing really well, and they've managed to build a brand. They've managed to build a relationship with doctors in the area and with patients and consumers in the area by giving really good service. So is there an opportunity to put some of these labs under a common umbrella that I call Metropolis, bring them in, acquire these practices, and actually convert them from their sole proprietorship way of working, where it was one boss and 10 employees sitting in 200 square feet, to making them into a lab which represents a brand in that particular city? And was there a way to really consolidate the industry in that way? And again, slightly easier said than done, because healthcare in general, like the CA business or like everything else, is actually a family business. The doctors will have their kids who are doctors, will have their kids who are doctors. So this was generally a succession plan that went down the family. And all of them, when I talked to them, they said, oh, no, we don't want any outsider. We are very happy our daughter or son will become a pathologist and they'll sort of carry on the name. So I remember the first such acquisition or partnership being a real challenge. And it literally was sitting down with a pathologist and spending a year to convince him bit by bit. And he said, what if you come and take over my operations? What if you come and give me no independence? So it was quite challenging to convince. But if I look at it in the past 15 years now that I've been building this, we've gone from one lab to about 125 labs and 800 centers, and we're now in 7 countries. The initial 5 years were actually quite slow. So there was no capital. So literally from 2001, since I started building this, besides a salary, I haven't taken anything out of the business. I have replowed all the profit back into the business year on year. And I think that was one of the best decisions that I could have made, because it avoided me taking debt and avoided me taking private equity till a stage that I was actually mature enough to handle either of them. Because part of the business has to be mature, and as an entrepreneur, I think you have to be mature to handle those relationships. So till 2006, I actually sort of propelled it with internal accruals, and only then sort of went out and took private equity, which was ICICI Ventures, which was our first investment. The challenges were actually quite unique, and there was really no path of a company who had done the same thing that we could actually follow. So a lot of it was just figuring out challenges along the way. Where do you get the capital from? How do you convince these pathologists to come as part of you? Once they've come as part of you, how do you convince them to change? Because when you're starting something new, it's actually sometimes easier than taking something which is already being done in a certain way and then converting it to the way that you think it should be done. Because that change management requires changing the person's mindset. And when I was dealing with people who are usually in their 50s and 60s, their thought processes and their processes were already defined. They said, no, for 30 years, I have been opening from 8 o'clock in the morning till 12 o'clock. And then if a patient comes at lunchtime, I say, go home. I am not going to deal with you, or you come again at 4 o'clock. That was the mindset in 2001. There was no customer centricity. There was no thought of, I have to give a great experience to the customer. The mindset was, I am a doctor. The patient will come when I am free, nahi to bhag jao. That was the mindset. So to move that into becoming, to say that, look, the customer matters. The service you give matters. You can't just say, I'm a quality player. You need to benchmark it. You need to show again and again, consistently, every time that they're with you, whether a doctor recommends or a patient comes directly, that you're able to give exemplary quality and service every single time. Because in healthcare, finally, if your diagnosis is not correct, your treatment can never be correct. So unless every time you're perfectly bang on in your accuracy of exactly what the problem is inside the body, your treatment will go awry. And then, of course, your quality and your reputation goes down the drain. So I think a lot of these challenges were very interesting to figure out at every step of the way. I remember in 2005, I got an opportunity to look at international markets. And at the time, we were only in India, in maybe 6 cities. We actually had not even penetrated India completely, and I got an opportunity to go to Sri Lanka. And I jumped on it because I thought, if we are the first ones who go multinational and we are the first ones who are international, it'll help us build our brand. People will think that, this is an international company and therefore the quality is much better. And the reason we felt the need to differentiate in this way was because there is no regulation in our industry. So even today, by the way, the path lab is not governed by anybody. There is no government institute or regulatory body that goes and checks to see what's happening. This is all self-regulated. And the accreditation process is a voluntary accreditation process. And even today, less than 2% of labs in India are actually accredited. So because of this dynamic of the market, we were getting compared to people who were actually taking the sample, pour it down the sink, and give a report. So this comparison between apples and oranges was really troubling us, because we said, how do we differentiate ourselves in a market where the service is so intangible? You're giving a piece of paper to a consumer who doesn't understand what's on that piece of paper, goes back to the doctor and expects the doctor to interpret it for the patient. And sometimes the doctor's agenda and your agenda is not the same. So how do we really think about moving past the middleman and really establishing our credibility with the consumer directly? And although we were in a sort of a B2B business, we really tried to become B2C. And the question was again, how? It was through simple things. We said, let's take every opportunity with every patient who comes to us to reach out and communicate, to build that relationship with every patient who walks through the door. As soon as they walk in, they should be able to feel the difference in experience that we're providing or somebody else is providing. Let's create those CRM programs. Let's create those loyalty programs, even though this is not in a B2C market. And the doctors, by the way, this whole time were putting up their hands and saying, don't talk to the patient directly. You talk to me only. So there was this constant dynamic of having to balance the relationship with the doctor and having to balance with the patient. But when we had this opportunity of going into Sri Lanka, it was again a very, very interesting opportunity, because there was a hospital chain there who said, look, can you partner with us? And then can we grow this chain across Sri Lanka? And this was a model, again, we had never really done before, where your customer also becomes, by the way, your partner. Very complicated and very conflicted relationship, right? Because you're sitting as shareholders together in the same joint venture, but this guy also happens to be your main customer. So there were a lot of these complicated dynamics that we had to take on to constantly create new business models to be able to enter new markets, because the business is so local and because one pathologist in one area was not recognized from the other. But if I look back, and of course, post Sri Lanka, we went into Middle East and into Africa, and I'm currently building the same chain of labs like I've built in India across the African market, because I really believe that that's the next frontier in terms of growth. And the kind of growth that we've seen in India in the last 10 to 15 years, we're going to now see in Africa in the next 10 to 15 years. So I'm literally going country by country, setting up base, putting people, putting systems, and really building from ground up. Acquisitions in our industry are far and few between. So there is no inorganic opportunity to really just go and buy something big. But if I look back and I look at the hindsight of this entire journey of the last 15 years and what have been my sort of biggest lessons, and I would love to share with some of them with you. I think the first one sort of came in, and especially for the young entrepreneurs here, a lesson which I learned was literally with some power will come great responsibility, right? And the understanding that the minute I take money from an investor or the minute I take money from a bank, it is my responsibility and my really my responsibility to make sure that trust and credibility is not broken. The minute I take some materials from a vendor and he's giving it to me on credit, again, my reputation on the line. The minute I get an employee on board and I sell a big dream about who we are going to be and how we're going to grow, my responsibility to make sure that I'm delivering that dream to my employee. And I think that understanding of that level of responsibility actually made me, I wouldn't say cautious, but made me careful in the commitments that I was making. And over the last 10 years, I've had 3 rounds of investors, all one better than the other, global names, blue chip names, people willing to come and back me, people willing to come and give me debt, people willing to come and invest money in my business, singly because of this reason. Because every time they did a ref check on me, whether it was an employee, whether it was a supplier, whether it was a stakeholder, whether it was a bank, there was always somebody to say, yes, you can go ahead comfortably, and these people are not going to shortchange you. So I think that was a very important lesson along the way. I think the other important lesson is that I think, we focus a lot as entrepreneurs on the outcome. We focus a lot on the fame, the money, wanting the plane, wanting the press, wanting, the status symbol, the jet-setting lifestyle. But actually beyond sort of all of that, I think besides looking at the end of the destination, I think what's really interesting is genuinely the journey along the way. This reminds me of a quote I remember that Edmund Hillary made after he had conquered Mount Everest. And he said, "It is not the mountain we conquer, but it is ourselves." And I genuinely believe that that's been the most interesting part of the entrepreneurial journey. If you look at in a startup phase, an entrepreneur has a very different role from the role an entrepreneur plays when the company is in a middle stage, or the role that an entrepreneur plays when it's in a very large stage company. So in an early phase, in a startup phase, the entrepreneur is the whole and soul, right? You are the living blood, you are the life, you are the oxygen of the business. And everything you dream will be dreamt by the organization. Everything you do will be done by the organization. And finally, your temperament and your personality will completely shape the organization top to bottom. So if you're impatient, you will find the same thing down below. If you're somebody who's very aggressive, you will find the same thing down below. And that actually brings us back to the same responsibility. Because at least for me, as I've grown my business from a startup to where it is today, me and my business mirrored each other for the first 6-7 years perfectly. All my strengths and weaknesses were in my organization and vice versa. And is that necessarily a good thing? I'm not so sure. But that's the case, it is for the first 6-7 years. But that's why I felt that the more we're able to actually focus as entrepreneurs on our own minds, on actually confronting our own fears, on actually figuring out what are our own weaknesses as individuals and trying to overcome them, the better the chance of your organization overcoming all those limitations which have been built into their personality, into the organization's personality. So the only message I want to give here is that I think as an entrepreneur, when you're busy building the business and growing it, just watch out for constantly working on yourself as a human being, as an individual, as a person along the way, because it will mirror perfectly. When you go to a middle stage, like I'm today in a medium-sized organization, we've got about 3,500 people, we've got branches across. In this medium stage, where again you're on an expansion path, you're growing, but you're also got worries about costs and you're managing 50 other things along with it, you usually find that the personality of the organization has become slightly different from the entrepreneur, right? Because you've got team members, you've got other leadership team, and at that point of time, the personalities have come as a combination of many different things. And that's frankly more balanced for the organization rather than only mirroring one individual, where the full dependability is on one individual. And I think at this point of time, the entrepreneur's role is actually to take a step back and allow the organization to develop its own personality, allow the organization to be influenced by many other people rather than only the entrepreneur. And I think when it gets to a much larger stage, today, whether it's in HDFC, if you talk to Deepak Parekh, he'll tell you, he says, my role in HDFC is to bring personality back into the organization, because the organization is now so big that it stands to lose the opportunity to lose character, to lose soul. And that's where the chairperson or the entrepreneur, the original promoter, can spike that soul back into the organization to stay true to the original values and the original principles of the organization. So I think as you go through each stage and as you go through this evolution of your businesses, your role and therefore your organization will keep evolving, and you'll have to keep watching for what role and what influence you play in the organization. The other part which was very interesting to me, which I think I've learned along the way, was that opportunities kept presenting themselves. So, we talk about international business. As I mentioned to you, Sri Lanka came, UAE came, South Africa came. Opportunities kept coming, right? Because we were aggressive, kept looking for different things. And one thing, at least when I look back now, it's as important to know when to say no as it is when to say yes. Very, very crucial. Because if I think back and I think of a number of opportunities which I picked up and I took because I thought if I don't take them, somebody else will, or if I don't take them, I'm going to lose out on the treadmill that I'm running on, that I wanted to take as many opportunities that came. But was I and was the organization ready? Did we have the bandwidth which could manage the kind of international expansion that we were looking out for? Was there systems and processes that could support an international expansion? Were the mentality of the people of my team ready to deal with international cultures and different ways of doing things? So there's a whole host of things that come in as question marks before the opportunity is taken. And the challenge of taking an opportunity that doesn't work out well is that you may actually do the business for 3 years, but then you spend the next 10 in unraveling the problems caused by that opportunity. So the mindset to really question and say, do I want to say yes to everything, or do I want to be more selective and say, no, actually, I'm not ready for this, and it's okay, I'm going to wait for a couple of years. I think that would have been a great lesson at that age. The last thing I would say is the fourth thing, which is on a matter of perspective. I think as startups, I think especially by people who are young, the only thing lacking, I think, in youth, and at least I can speak from my own perspective, when I was in my early 20s, is perspective, and that usually comes because of a lack of experience. And building a team of people who you can consider advisors, mentors, friends, who can bring that perspective to you as an individual, to bring that perspective to you as a business, is irreplaceable. I didn't do that for a long time. I didn't do it for 15 years. 15 years, I thought my common sense was enough, and I just kept building the direction that I thought was the right way. And to be fair, it worked out reasonably well. But I'm doing that now. And I'll tell you, when I see the kind of advice, the kind of mentorship, the kind of help I'm getting today by just reaching out and asking people, you'll be surprised as to how much impact it can actually have on the entire decision making. And those key decision points when you're at those junctions, should I go right or should I go left, which can determine the next 5, 10 years, you have perspective that is genuinely very, very helpful. For me, this has been personally a personal passion, because as a woman entrepreneur in India, the journey is quite different actually from a male entrepreneur. Because of the social conditioning in the country, women have a slightly different experience, and some challenges can be much more. So I'm actually in the process of, I'm building a platform actually for women entrepreneurs who are very keen to grow, but who don't have necessarily the financial support, they don't have the emotional support, they don't have the mentorship, they don't have the guidance on how to face the challenges, because usually there isn't anybody in the family or in the friend circle that can provide that. But that's a personal passion. But the journey of the last 15 years has been incredible. I mean, I wouldn't replace it for anything. With all the good, bad, ugly turns, difficulties, challenges, it has been the most exceptional journey. And to me, the most exceptional part of the journey has been how much I've learned about myself at every step of the way. Because there is really nothing like entrepreneurship, where you're put in a difficult situation pretty much every day of your life to really figure out what you're made of. You know, what is your level of courage? What is your level of giving up hope? What is your character? What is your mettle? And I think that to me has been really the most interesting part of this last 15 years. And thanks for having me today. And it was a pleasure to share my thoughts. I'd be happy to answer any questions.
The main point is that to start, convince the existing mom and pop stores to become, so I mean, the right challenge is that, are you going to dominate me, or am I going to do my thing? So could you please elaborate, like, how did you deal that? Okay, we're not going to overcome you, you're becoming part of my team. Could you elaborate that?
So I think a lot of building services businesses, you require as much EQ as you do IQ, because a lot of these things are not intellectual. A lot of them are generally just about building relationships where you can make the other person feel comfortable, that there is no agenda. So I think the first thing that helped was just to be very straightforward, and to give them a feeling of comfort that there's an honesty in the relationship, that there isn't an agenda of a corporate takeover. When there was resistance back and said, no, my children, no, I'm not sure, no, I don't know about the numbers, there were lots of questions. I think it was just having the patience to actually answer every question. I think for every partnership I've done, and I've done about 25 of them in the past 15 years, it must have taken me an average of 1.5 years to convince a single partner to join with me. And that 1.5 years meant meeting after meeting after meeting after meeting, not only with the pathologist, but a lot of times with the pathologist's brother, the pathologist's parents, the pathologist's kids, the pathologist's CA, the spiritual advisor. So there have been a whole community of people who need to feel comfortable that this person that they care about is getting into something that is going to be a good relationship for them. And I think it is just the way it is about building a friendship, or it is about building an equation with an acquired family, that you just keep making that effort. And like anything else in life, out of every 10 efforts you make, 1 will work out and 9 will fail.
Apart from providing some healthy environment in your labs, what was the customer relationship, like, tactics you used, like, to get more customers in your labs, and, like, how to build up that relationship with them?
Yeah. So one thing we realized very quickly is that even though we want to try and build a relationship with the consumer, there is no way you can try to either cut out the doctor or replace the doctor's role, because that role is a very, very crucial role in the entire equation, because the doctor is the guy who's actually treating the patient, right? The doctor can't do it without the right diagnosis from me, but he's the guy who's actually building the relationship with the patient. So we built a sales team to go and actually educate doctors and build awareness. And because of this mindset that a routine test is common and can be done at any lab and it doesn't matter, and only specialized tests require quality, by the way, which is not true, doctors had a mindset to say, oh, the common tests I'll send to the local lab, and specialized tests I'll send to Metropolis because important. So we used to go doctor to doctor. So I have a sales team of 250 people who will go meet doctors across the country. So choose your right doctor, figure out what's important to them and convince them and educate them on what they don't know. So there are lots of things which obviously doctors are not updated on. So that was one piece to keep them in the loop. With consumers, the idea was always to say two things. One, when they come in, when they have an experience with us, every touch point has to be the moment of truth. Whether it is when they pick up the phone and call us, whether it is when the phlebotomist is drawing their blood, whether it is when they walk into the center, how it smells. Does the receptionist smile, or does the receptionist give them a feeling of a dreary atmosphere? What is the biggest issue why people don't like going to hospitals, right? Because there's this sense of brood, there's this sense of something's going to go wrong, or there's death. And we didn't want to replicate that atmosphere. The idea was to create an atmosphere of wellness. So where there's somebody smiling, where there's somebody who walk in, there's somebody who's interacting with you when they're taking your blood. The consumer feels confident that everything is done up to global standards. The consumer sees the hygiene, the safety with which you're dealing with the consumer, the warmth with which you're dealing with the consumer. So it was all about the experience and working on every moment of truth and point of interaction. So that was very key. And the second part of it is that if you see pathology, usually what happens is a patient falls sick, a patient will go to a doctor will say, oh, you have a fever, do these tests. Patient will come to the lab, go back with the piece of paper, the report to the doctor, and the doctor will interpret the report. So what happens is the relationship between the patient and us becomes transactional. They come, they give blood, they pay money, and we give them a report. So I wanted to change this. I wanted to say my relationship with you is not transactional. I want to genuinely build a relationship with you. So how can I be in the patient's life on a day-to-day basis, even if they come to my lab only once a year when they fall sick? In that moment of anxiety, how can I hold that patient's hand and make them feel more calm? How can I give them comfort over fear? And so the rest of the year, when they were not coming to the lab, we found ways to get into their lives. Whether it was sending health updates, whether it was creating a mobile app which gives daily basis health tips, whether it makes it more convenient for the patient to access us, whether it's about creating the network so you're close to their home and they don't have to travel too far to come to you, whether it is providing a home service at home, where at 6 o'clock in the morning somebody can sit in their pajamas and I can get the blood from their bed and give them a report by email so they don't have to get hassled. So it was a lot of small things which we had to do right versus any one big thing.
So, were you targeting any countrysides apart from the metros and the cities?
So today
What were
we're
the
in
challenges
250 cities and towns across the country, right? So it's about making sure that you're close to the patient, which means you need to have a spread of network, and that's very, very crucial.
Ms. Shah, that was wonderful talk there.
Thank you.
And congratulations on where you got now. Now you stand at 125 centers, and you've mentioned 800 collection centers and such now. Going forward, what's on your mind with respect to technology and, taking care of the aspect which still hasn't been addressed, which is, it takes a day to get a report.
I'm sorry,
It takes a day to get a report back after someone comes to your lab and gives a blood sample. Maybe not at yours, but most of the labs anyway out there. What's the role of technology to kind of bridge that gap next and see how you can move technically, ideally, if the doctor who has seen the patient who has come in with fever is able to actually, in his own presence, make some quick determination of what may be the problem. Is the WBC count high? Can I do something about it? Is there a role you see there, or do you think that all the problems you discussed before in terms of the lack of, opening up of the traditional way of how we have dealt with medicine, continuing to be a problem to be able to fix this aspect?
So healthcare is a slightly stodgy and traditional industry. Things have worked in a very old-fashioned way. What is the ideal situation? The ideal situation is if a patient walks into, is able to do a teleconsult with a doc, if he's got a minor issue, over a cloud system somewhere, is able to do a teleconsult. The doc emails him a prescription of tests, which prescription also goes to the lab. The lab automatically schedules a home visit for the patient. The reports are then emailed to the doctor. The doctor then does a teleconsult and tells them this is what needs to be done. Ideal situation, right? And that's the direction that all of us hope things move into. Having said that, the industry hasn't still progressed to that level where doctors are comfortable with technology. So today, if you ask me the biggest obstruction, all of us are ready So today, out of this entire chain, I can collect your sample at home at 6 o'clock in the morning and I can give you the report by 3 in the afternoon on email. Not even a day, 7, 8 hours, right? No issue. The challenge today being faced is that the doctor himself, who's the fulcrum of healthcare, is not a tech-savvy guy. So therefore, everything is manual. When a patient goes to a doctor, carry manual files. When we email reports to the doctor says, no, don't send me email, you send me hard copy. So that has to change. And that change is actually a mindset change. It's a cultural change the doctor is going to have to bring around, which if you look in any other country, has been driven by insurance. When insurance companies come in and they say, I'm going to pay you, doctor, for the service you're providing to the consumer, and it is not the patient paying out of pocket. The insurance company demands and says, you need to fill this data in my database, otherwise I will not pay you. And that's where the change comes. Unfortunately, health insurance is also at a very nascent stage in India. So we still haven't gotten to that level. But over the next 5 years, this industry is going to change completely. And I genuinely hope we're going to go in this direction. For our own industry, we're seeing, while it's always been an industry built on word of mouth, today the impact of social media, the impact of getting a review, a possible review done, the impact about learning and taking health in your own hands. I mean, till 5 years ago, preventive healthcare, which meant that you go and take care of your health before you're sick, was probably less than 1% of the business. Today it has gone to 5 to 10% of the business. What does this tell you? This tells you that people are getting more aware and educated and wanting to actually get more involved with their own health. And this is a good sign. Why do we depend only on doctors to take care of us? Let's take care of ourselves. Let's get more information to find out what's going on. Can we track our own results? Can Metropolis give you analytics to say my sugar level over the last 4 years was XYZ? Can I email that to somewhere? Can I understand what does a creatinine do in my body? So I think the ability and the move of the consumer to get more involved in their health, the movement of the consumer to move completely to mobile and cloud is going to dramatically change this industry over the next 5-10 years. And I think the opportunities, by the way, for startups in healthcare are tremendous. The issue only comes in getting the trust and credibility in health because it is a long gestation business. But if you're working with a brand, I think there's a tremendous opportunity in doing it. And I'm actually very excited to see how healthcare is going to change. And we're actually driving this from a consumer angle, from a leadership stance. Thank you, everyone. It was a pleasure to be here.